I'm going to have some fun here. All right, I love going last, too, just like Julie said. So, yeah, don't be silly. Let him play. This doesn't require surgery. And by the way, Drew told me himself that if it was his RCL, he never would have had surgery, right? He would have gone back right away. And he went back at 4.5 weeks, was able to throw a ball at 4.5 weeks with the splint on. Splint was very comfortable. He's still playing with the splint on. So anyway, let me get into the talk. I think you missed a little bit of literature as well there, Brian. And I think the Texas heat has done something to your brain. Let's see. Okay, so the RCL. This is the RCL, right? This is not the UCL. The RCL is usually torn off the metacarpal, but it's right there, right? You rarely see a steno equivalent, right? You rarely see that, just like you maybe would with the UCL, but it's usually hanging out right where it needs to attach. Okay, if it's a steno, a UCL steno, we know to go fix those pretty quickly. But these you can fix later if you have to, because there's nothing getting interposed. Here's an article. I think you missed this one. This came out this year. The efficacy of primary repair in professional athletes with chronic radial ligament injuries of the thumb MCP joint. 12 elite professional athletes, 15 RCL injuries, delayed surgery. Okay, they waited till after the season. Played with a splint during the season. Mean follow-up over 4 years. Range of motion and strengths comparable to the unaffected side. All of the 12 patients had a primary repair, no reconstruction. Okay, and return to their pre-injury professional level. So this is pretty, I think, convincing to me, and this is what I see in my practice as well. Immediate surgery, no way. Put away the knife. He can play with the splint, okay? Drew is still playing with the splint. I've seen tons of athletes that can play with the splint. You give them a couple weeks, let the pain die down, and they'll be fine. They're not gonna get arthritis right away. Give them a few months to get through the season, and you can fix them later if you have to. Results with surgery, we know, are much more unpredictable than fixing UCLs. UCLs are pretty easy, have pretty good outcomes compared to RCL repairs. I've had a lot of RCL repairs stretch out over time. That adductor pull, that EPL pull, is very, very strong. And the player will be losing time. You're messing with this player's career. Okay, he's got a scholarship. Maybe he wants to go to the NFL or whatever sport it is. Don't mess with his career by taking him out of the season, out of play during the season. Deal with it later. Okay, this is just a picture of what you can do. Dr. Adams mentioned the internal brace, and I think this is particularly good for the RCL, even more than maybe the UCL. You can put a pin in there as well if you want to. This does add a significant strength to the repair, and you can get them moving pretty quickly. So, pretty short talk here, but I don't think I needed 20 slides to convince you that treating this during the season is the wrong idea, that you can treat this after the season is over, let them play, and they'll still have a good result. I've seen so many RCL tears in professional and collegiate athletes that I never operated on. They did just fine. I think I've seen a player from every NBA team in California, and none of them ended up having surgery, and they're still playing. And if they do need surgery, you can do it later. Thank you very much.
Hey, Steve.